Ladies and gentlemen, good evening. We come together once again this weekend to talk about yet another grim topic, that's on suicide. Last week, we talked about depression, various causes, the types, how it presents, and what we can do about depression. And last week we said one of the dangers of depression is suicide. And since suicide is a big topic by itself, we thought we will deal with that this week. So whenever we talk about suicide, we always go with a rather sad feeling or a grim feeling. We could have avoided this. But suicide is a reality that happens every day in this world. So it's good for us to look at this in detail, though it may be a sad topic. Last week I said, many famous people like this person, Andreas Lubitz, he was an airline pilot, German wings, and he crashed his plane along with his passengers in the French Alps, killing 150 people. And we also saw about this person, Ron Williams, a famous actor, was acted in many movies, humorous movies, made thousands of people laugh, but he himself committed suicide. And recently, we know Sushant Singh, a Bollywood actor who committed suicide. All these are in our mind. But what is this suicide? The word suicide comes from the Latin word suicidum, killing self. Merriam-Webster dictionary defines suicide as the act of taking one's own life voluntarily and intentionally. But every suicide is a tragedy. And in some sense, it is a mystery. It's a mystery because we all want to save lives. We want to save ourselves. We say self-preservation. But why is it that some people want to just the opposite? They want to kill themselves, destroy themselves. So in that sense, it's a mystery. It is the inability to see solutions to problems or to cope with challenging life circumstances and taking their own lives as the only solution to what is often really a temporary situation. But most survivors of suicide attempts, they go on to live full, rewarding lives. Let's look at some of the facts about suicide. Do you know that 8 lakhs of people commit suicide every year in the world? And that means every 40 seconds, one suicide takes place. That's a large number. This is 1.5% of all deaths that take place in the world, or in other words, every year there is 10.6 people per lakh. For example, if you live in a small town with a population of 1 lakh, in your town, nearly 10 or 11 people will commit suicide every year. And Europe is supposed to be the most suicidal region in the world, especially the Eastern Europe. And Eastern Mediterranean, on the other hand, is the least suicidal. We think that suicide happens with the most affluent and rich people, but in fact, World Health Organization study shows 75% of suicide occur in the low middle income countries. Suicide deaths are more than deaths by malaria, war, or even homicide. This is surprising. The last week we said depression affects women twice as much as men. But when it comes to suicide, men, double the number of men commit suicide than women. Just the opposite. And in the 15 to 20 age group, suicide is the third leading cause of death. And the second leading cause of death is lower respiratory infection. And what is the first leading cause of death among young men? 15, 29. Can you guess? I don't know whether I guessed it correctly. It is road traffic accident. Among young men, that is the number one cause of death in the world. And among women, suicide is the second most common cause of death. And the first cause, of course, is other maternal causes during delivery and so on. Let's come to India. In India, the total number of suicides is 16.5 per lakh. But globally, it's only 10.6 per lakh. Indian population is about 17% of the world's population. We have almost 17 per lakh, 16.5 per lakh suicides per year. And among women, it is the third highest in the world, next to South Korea. South Korea, the suicide rate has suddenly gone up very much. And among the people between ages young, 15 to 39, it is a number one cause of death in women in India. In 1990, it was tuberculosis was the number one cause of death. But among women in this age group, suicide is the number one cause of death today. In the same age group, 63% of all suicide occurs in this age group, young age. And higher suicide takes place in the southern states and also in Maharashtra, West Bengal, and Tripura. Southern states are supposed to be the more literate, more developed, but suicide is also highest in the southern states. And among men, highest suicide is in Kerala and Chhattisgarh. Some of the number of suicide among women is much less in Kerala. So this is some statistics about suicide in our country. Now the suicide rates, is it increasing? Let's look at that. In 1990, the suicide rate in the world was 20 per lakh. But in 2016, it's only 16 per lakh. Suicide rate seems to have come down over the last 16 years. But it's variable with various countries. In USA, for example, suicide rate has gone up. In most countries, it has come down. In USA, in South Korea, and some of the other countries like Guyana, a few countries, suicide rate has gone up. But in general, it has come down. Even in India, the rate has come down. And suicide among women, in 1990, it was 20 per lakh. And in 2017, it is 14.7 per lakh among women in India. But in the world, it's half of that, only around 7% among women. Suicide rate has come down so much, but India has doubled that among young women, among women in India. Now, student suicides, that is a concern. Every 1 hour, one student commits suicide according to the National Crime Bureau report. And in IIT alone, from 2014 to 2019, 27 people committed suicide, premier institutions. And a Lancet study showed in 2012 that among the suicides, 60% are women and 40% are men. That's in India. Some of the causes for this student suicides, possible causes are, one is a lack of emotional support for the students. High expectations that students have nowadays, and they're not able to reach that. It's much more competitive than earlier days. And there's a lot of parental pressure and peer pressure for them to perform. And there are relationships problems, broken love affairs. These are some of the causes for student suicides. There are different types of suicide. Emil Durkheim, years ago, he presented a paper. He was a sociologist. He said the main cause of suicide is social. Not that everyone agrees with that, but that was a very remarkable paper, very famous paper he had published. His study says the cause of suicide is mostly social, and he divided the suicides into 4 types. One is egoistic suicide. That is, person who is self-centered and socially isolated. He thinks about himself, his problem, and he wants to commit suicide. This is egoistic suicide. The next is altruistic suicide. Here, the group and the individuals, they are too closely integrated. They feel they are responsible for the society, or their dying will benefit the society, or they're not fit to be in the society. So the integration with society is too much. For example, sati, all these social causes. This suicide is called altruistic suicide for the sake of the society. Then anomic suicide. This happens when there's a breakdown of social equilibrium, such as a suicide after a bankruptcy or some sudden catastrophe. Person feels isolated, feels there's no social support, and he commits suicide. Then the last one is fatalistic suicide. Fatalistic. This happens when there is an over-regulation in the society, when the servant or the slave commits suicide because there is no way of escape. When a barren woman commits suicide, there's no hope. Or nowadays, suicide in the prisons or in the police lockup, if you can call it suicide, that might come under fatalistic suicide, when a person feels there is no escape, fatalistic. Some of the methods of suicide. In India, poisoning is the #1 method, especially with pesticides, organophosphorus compounds, chemicals, medicines, overdose of medicines. This is the commonest form of suicide. The next is hanging, not as common as poisoning. And self-immolation, burning themselves, is more common among women. Younger women is more common, burning. Firearms, not so common in India, but it's very common in countries like USA, where firearms are very common. These are some of the common methods. There are various other methods, but in earlier days in Europe, commonest method was the cooking gas, which had a lot of carbon monoxide. Now they changed that so that it's not much of a problem now. Why do they commit suicide? I showed this slide last week about the cause of depression. It is applicable for suicides also. This is a picture of a normal man, as I said last time. The normal man with a box on his head. And what is that box? Stress. Stresses of daily life, everyday life. We all manage with the stress. We don't go and commit suicide. We cope with those stresses and get on with life. We can even get on with a smile. That is a normal man. Now look at this man. He is depressed because he has too many stresses. Maybe a very big stress, or one stress after another, or a cluster of stresses. It's too much for him to cope with. Sometimes such a person may attempt suicide. And the third person is also depressed. He may also attempt suicide. But look at him. The load on his head is the same as the load on the normal man. But then why is he depressed? Why should he commit suicide? Look at him. Compared to this man, he is a smaller man. In other words, he has not learned good coping skills in life. He cannot even cope with ordinary stresses in life. Therefore, a small thing may push him to commit suicide. Many students we see, they commit suicide when they hear the results that they have failed. As if passing is the only thing in life. They can't cope with that and they go and commit suicide. So their personality is immature. They're not learned coping skills in life. We see more and more young people nowadays like this. They have not learned. Unlike in the past, people probably are in a much easier lifestyle situation nowadays. They have not learned, or maybe the parenting style is different. Parents don't allow the children to face any stress. And as a result, when they grow up, they go out of the home, they can't even bear ordinary stresses in life, which a common man would bear. What's the cause of suicide is always a question. We can probably never identify a specific cause, say that this is the cause of suicide. Usually there are multiple causes, and often we cannot pinpoint a cause, but we can look at some of the common risk factors. Important risk factor is a psychiatric problem. As I said earlier, 50 to 70% of the suicides are because of depression. That also goes to say not all who attempt suicide have psychiatric problems. No, that's not true. About 50 to 70, but that's a major chunk. Problems such as mood disorders, depression, or bipolar disorder, schizophrenia to a lesser extent, borderline personality where their personality is unstable, alcohol and drug abuse is also an important cause for suicide. Many people with this drug abuse problem commit suicide. The next is the relationship with friends and family. Domestic violence. Domestic violence is an important cause of suicide among young women. Then life events like retirement, redundancy, feeling that they're redundant, especially in older age group, when they feel that they are done, they are no longer useful to the society or to the family, or difficulty in adjusting to big changes in life. Then social causes like social isolation, again in older age group, people feeling isolated, feelings of shame. And this again cultural, in Eastern culture, especially India and Japan and all, shame is considered to be like a very high importance. And in many of our literatures in India, they say it is better to give up your life rather than live with this shame. A lot of this honor killing and so all this, because we hold a lot of value about the honor and we cannot withstand shame. So more than guilt feelings, shame we are afraid of. Losses, any kind of losses, financial loss, loss of people, like grieving a death of a very loved one, loss of prestige, failures, and imprisonment. All these are social causes, risk factors for depression. We said, when I talked about depression, 3 cognitive factors, or the way we think, are important for depression. The same 3 factors are important for suicide also. Therefore, if you want to help someone, or if you want to know if somebody could become suicidal, better to look for these factors. One is hopelessness, ideas of hopelessness, if they express. Ideas of helplessness, that they are not able to do anything. They feel very helpless. And ideas of worthlessness or uselessness. They feel they are not useful to anybody. These 3 things are important risk factors for depression. There are other risk factors such as chronic pain. People suffer from chronic pain after a trauma. In fact, one study in US says that 22% of girls who were raped, they had attempted suicide later in life, 22%. Not only that, any other trauma, any severe trauma they suffer in younger age is one of the risk factors. Even some years later, it plagues them. If there is a family history of suicide, this the risk of persons committing suicide. The lack of faith in God. In fact, faith and trust in God is one of the things that helps people when they go through difficulties, depression, and in crisis. And the lack of faith in God is one of the risk factors for suicide. Marriage, that's interesting. When you talked about depression last week, we said marriage is a protective factor for depression. People who are unmarried, divorced, or widowed, suicide is more among them. Interestingly, I mean, it is true, even for suicide also, marriage seems to protect. But interestingly, studies in India show that marriage is no protection for suicide. In fact, among many women, married women commit suicide more than single women, especially in the early years of marriage. So being married is one risk factor, especially early years of marriage in India, it seems. But later on, after some years of marriage seems to give some protection. Probably because by then women learn to cope with life situations, they learn to adjust with people, and more important, they have now children and they want to live for children. Their main concern is bringing up the children. That somehow gives them a hope or something to live for, and so that seems to protect them, older women after marriage. A feeling of being a burden to others. This is one thing many people with suicidal ideas say, that I am a burden to others, especially older people. When they feel useless, they have done all the things that are useful in life, they can feel like this. So therefore, two important risk factors among all this to consider is, one is ideas of hopelessness. That alone is a high risk factor. And the second one, past attempts of suicide. If a person has attempted suicide once, the risk of attempting again is 5 times more than in the general population. So these are two important risk factors. Then, of course, genetic and biological causes. We said when we talked about depression, about the biochemical change in the brain, how certain changes in the chemicals like serotonin and dopamine can make a person deeply depressed even without any external factors. A person may have a happy situation, happy family, happy work, everything is fine, but a person feels depressed. People can't understand why. And the same person often has severe suicidal thoughts also. One of my patients told me, "Doctor, I want to commit suicide, but I don't know why." Isn't that interesting and puzzling? I want to commit suicide, but I don't know why. But I keep getting the thought that I must commit suicide. These are the people who have these biochemical changes in the brain, which make them feel depressed. And one of the signs of severe depression is suicidal thoughts. And they may attempt also. The other thing is the role of the media. There is evidence, there are at least 2 research papers which shows that glorifying and graphic reporting of suicide, especially when it's related to suicide method used, can trigger imitative attempts by vulnerable people. This is called copycat suicides. We talked about Robin Williams. After his suicide, there was an estimated 1,841 excessive suicides in the United States. That is 10% more than expected. An increase of 16% was seen in Canada and 11% in Australia at the same time after this suicide. Therefore, the Press Council of India in September 13, 2019 has given this instruction to all the people that the press or the TV or social media, they must not place stories about suicide prominently, especially in the front page, and they should not unduly repeat such stories. They must not use language which sensationalizes or normalizes suicide or presents it as a constructive solution to problems. They must not explicitly describe the method used for the suicide. They must not provide details about the site or the location. They should not use sensational headlines. They should avoid using photographs or video footage or social media links regarding those suicide. So the media is supposed to follow these guidelines. How can we assess the risk of suicide? This is what many people ask. Can I know if somebody is under risk? There is no foolproof method, but some of the symptoms that I said earlier, if present, will give us a clue that this person may be suicidal. There are certain rating scales, certain scales are there. There's one scale called sad person's scale. Why is it called sad person? This is an acronym, so you can read from here, sad persons. S means sex. Females are more likely to attempt suicide. But read the next line. But males are more likely to choose a more deadly means. This shows probably more women attempt suicide, but more men die of suicide because men attempt more deadly methods. Age, 15 to 24-year-old people are more under risk, and also above 75. Above 75, the death rate is anyway high for various causes. Suicide is not on the top level, but there are many among the number of people who die of suicide. Apart from this younger age group, there's also a slight peak in the older age group. Depression, of course, D for depression. If there are any previous attempts, any alcohol or drug abuse, rational thinking loss, they're not able to think reasonably, and there's lack of social support. And if they have any organized plan, if they have a specific plan, then there's a greater risk. When I say specific plan, for example, they may make plans like closing all their bank accounts or arranging their things, unusually arranging everything, setting things right. I know one family, the father sent the wife for shopping, the father sent the wife for shopping, and the daughters to some other place, two different daughters to different places. And when all of them left, he committed suicide by hanging. He planned carefully. Older people usually make more specific plans. So this, if they make a plan how to commit suicide, then there's a greater risk of suicide. Being no spouse, divorced, or single, among men especially, is a greater risk. And if they have any other concurrent illnesses, these are risk factors. Now, these scale people have used, and they found that it has a high specificity, but has a low sensitivity. In other words, there are many people who may be suicidal, may be missed by this. So they revised a scale called a modified scale, giving a little higher rating. For example, depression and hopelessness, they got a rating of 2. And when there's rational thinking loss, that's a grade of 2. And organized or any serious attempt, they are planning, number 2. Any future intention about suicide, number 2, like that. So rating, and it shows a score here. If anybody gets a score of 6 to 8, full emergency psychiatric evaluation is needed, treatment is needed. Score of 9 or greater, immediate psychiatric hospitalization is needed. Now, these are all not foolproof scales, but they are helpful. This is available in the, if you Google it, you can get this scale. Can we prevent suicide? Yes, many suicides can be prevented, though we cannot prevent everything. One is create awareness. For example, now you have come for this seminar, you have become aware about the various facets of suicide. Create awareness with other people, maybe in schools, in your departments, in your work area, or in the community. Have awareness programs about suicide. screening about suicide, who are under risk. A person, we can use scales like there are other scales also. We can use that to screen people to see whether they are under risk. Gatekeeper screening, training. Who are the gatekeepers? Maybe people, a school teacher or a classmate, a close friend, or maybe the religious head of the community, the pastor, or maybe the doctor, family doctor. These are the gatekeepers. They are the ones who are dealing with people every day or frequently. They should be sensitized for the signs of risks of suicide so they can identify some of these signs. And restricting the means of suicide, for example, poisons. There's a move that the pesticide should become less lethal. Use more of organic pesticide, which are less poisonous. And in countries where they restricted the use of firearms, guns, definitely the suicide rate had come down. So restriction practice, for example, in houses, don't keep the medicines which is easily available, accessible, keep it separately. In fact, when we admit patients with depression in the hospital, we make it a point to keep the medicines away from the patient in the nursing office. And in the rooms, see that there is no something to hang themselves, a rope or a knife or sharp objects. All these are means for suicide. Restrict access to them. That will reduce suicidal attempt. Then follow-up care. Anyone who is attempted suicide and is treated and they're better now, follow-up is important because a repeat attempt is very high in the first week of being discharged. A repeat attempt is high even in the first 2 years, though not as much as in the first week. So they need follow-up care. And nowadays there are many hotlines and helplines. In fact, any news in many of the popular newspapers about suicide is always followed by this hotlines and helpline number. This has helped a lot of people. One of the reasons because this anonymity. You don't have to, you don't lose your privacy. You can call and that person doesn't know you, so they can seek help. And any help is better than no help. We say when we are treating patients, a counselor or a psychiatrist, even giving an appointment, I will see you next Monday, may prevent a suicide. He says, oh, at least I have to see the doctor next Monday, so I won't commit suicide. Oh, he doesn't say that. That's what works in his mind. Even giving an appointment is a hope. Suicide is a cry for help. It's like a drowning man. A drowning man will clutch at even a straw. So any hope is a help than no hope. And good media practice that we said already. And treatment, medicine, pharmacotherapy, we said antidepressants or even ECT makes such a marked difference to prevent suicide. Psychotherapy, counseling using various methods of psychotherapy. Now let's come to the topic of being left behind. All of us would have experienced the suicide of some loved one or a friend recently or in the past. I may be talking to someone who is grieving the suicide of a loved one recently, and we are left behind. We need to address the needs of the people who are left behind. It's a grief. They struggle to understand why this happened. So they are called suicide survivors, not the person who survived a suicide, but the other survivors who lost the loved one. They have grief like anyone else who had lost a loved one, but this grief is more than after a normal death and is of a different character because it is a traumatic aftermath. And there is stigma and shame associated with this, and there is a sense of isolation. There are mixed emotions, often an anger, a confusion, which is not so much there in an ordinary grief. And we often seek for a reason. Why did she do this? Wow. But why? No, there is a yearning, a search for a reason for it. And there's a risk of suicide among the survivors. There's a higher risk that they themselves may commit suicide. How can we manage this? One good management is getting support from others in the same boat. There may be others who are also facing the same situation. They can support each other. Getting professional help. We should not feel shy of getting professional help anytime when you feel that is becoming too much. We can be a friend in need to the person who is grieving. How can we be a friend in need? By staying close to the person, avoiding superficial talk, superficial reassurance. Now, what they need is not any consoling words. Of course, it is useful, helpful, but what they need more is your presence with them, holding their hands, telling them, "I am with you. I also grieve with you." That is what is needed. They want us to understand, share their grief. Don't ask for explanation. Why do you think he did it? This is not the time to ask for explanations. It is useful to recollect and remember his or her life, the one who died. And even though it may evoke painful memories sometimes, but it is helpful in getting over this grief. Also asking a question like, would you like to talk about this? Sometimes a person may say, no, I would rather not talk. Respect that. Even so, the person will be grateful for you asking that, would you like to talk about it? And that gives them a feeling that they have social support, even though they don't talk about it. We can help with practical things at that time when they are so distraught. Help them with the children, help them with some homework, help them with the kitchen, something we can do. A few myths about suicide, good for us to know. Did you know that people who talk about suicide are under high risk? Sometimes we hear people saying people who talk about suicide don't commit suicide. They only want attention. That may be true in some cases, but in most cases, people who talk about suicide do commit suicide. In fact, 1/3 of the people who had committed suicide have had told someone that about their suicidal thoughts and suicidal plans. This often in retrospective studies, they say, yes, she said about suicide, but we didn't take it seriously then. Therefore, anyone who talks about suicide, take them seriously. Asking about their suicidal ideas does not increase the risk of suicide. This is one of the questions that we ask people who are depressed. Do they have suicidal thoughts? And we may think that by asking, we are introducing a new idea into them, they may act on it. No, far from it. By asking about the suicidal thoughts, if they have, doesn't, or even if they don't have the suicidal thoughts, does not increase the risk of suicide. In fact, it reduces the risk of suicide, because if they have, we can help them. One suicidal is not always suicidal. It's true. The risk of suicide is higher, but many of them lead normal lives. Even those who make serious attempts do not always want to die. In our hospital, every person who is admitted with attempted suicide, after they are treated, they are sent to the psychiatry department for counseling. Almost all of them, maybe except with the exception of very few, almost all of them regret their suicidal attempt. Even those who make serious attempt. I have asked many people, do you want to attempt again? Most of them say no. So it is a very often they have not thought through it fully. Now they have time to think, they feel, oh, what I did was foolish or not right. What we need is hope. This is what we need always. Vanity, all vanity. Do you know who said this? King Solomon, who was supposed to be one of the wisest kings in old Israel, he said, everything is vanity. He said, I've seen all things that are done under the sun, and all of them are meaningless, chasing after the wind. He was one of the wisest kings. But that's what he said. But without faith, life has no lasting meaning. As Solomon said, life may be meaningless under the sun. May be true, but we need to look above the sun. Can anything be more illuminating than to see life from God's point of view? David, the father of King Solomon, said during the Psalms, even though I walk through the valley of the shadow of death, he said, I know you are with me. That is a great hope which has helped many people. King David once said in the Psalms, why, my soul, are you downcast? Why are you so disturbed within me? Then he said, put your hope in God, for I will yet praise him, my Savior and my God. So, life may be dark around us, but we have this hope. Let us look above the sun. Look to God, the source of all hope. Thank you.
Thank you, Doctor. That was pretty comprehensive. We've covered a lot of areas. Uh, just before going on to hope, Dr. Tharien spoke last on the subject of the myths surrounding suicidal attempts and people who commit suicide. So I'm going to take off from there, and I'm going to share for about 10 minutes before we quickly go on to the Q&A. I've deleted the ones that Doctor has already shared, so I'm going to quickly run through the rest of them. All persons who attempt suicide are fully intended on dying is not really true. Sometimes it's just an act of frustration. Only a psychotic crazy person can actually go through with suicide. All of us can go crazy just for 5 seconds, and if you make a decision in those 5 seconds, it could be fatal. Normal people who are too stressed or depressed just momentarily can do something like this. Like the saying goes, suicide is a permanent solution for a temporary problem. So we have to be able to see that. Suicide is not inherited, or it doesn't run in the family, but there's a high risk that someone would consider that because they have seen somebody in the family do that. And since it leaves such a deep emotional burn in the mind, that's one of the first options that comes when life gets difficult for them. In fact, just last week, I spoke to a suicide attempt survivor whose one parent had committed suicide. So it was always on the child's mind, and that was one of the first options he thought of when he thought life was getting too difficult. Suicide is a rich man's disease or a poor woman's way out. Not really true. Every person who dies leaves a suicidal note behind. Again, not true. We've seen recently with Sushant Singh also that he didn't just leave anything behind for us to say. Sometimes out of frustration, people leave a long note blaming people. When I was doing some research on this earlier, there was one guy who spent months and months writing 90 plus pages of suicide note telling in detail everything that led up to that moment. Very important, since you are concerned for your loved ones and you are looking out for how to spot the suicidal. If someone suddenly is withdrawn, isolated, and uprooted, especially if they were not like that before, like the doctor said, the deadly triad of depression, worthless, helpless, and hopeless, if any of these are being demonstrated by the individual. If there's a sudden eating and sleeping disorder, anything that is not normal, and if it persists for a longer period of time, lots of interest in activities and other interests which would generally be part of their lives. If there's a very important relationship that broke up recently, if there's a death in the family, bereavement, um, and something like that. If they say, I am thinking of committing suicide, even if they seem to say it jokingly, um, I think I may kill myself, please probe further and find out if they really mean it. Ask why and what made them say that. Don't overreact. Just ask. If you overreact and if you act shocked, then that might shut them down. They'll say, oh my God, I don't know where this is going. So they might not say anything to you. But out of deep concern, just ask them, what made you say that? If they say, I want you to know something just in case something happens to me, probe further. I won't trouble you much longer beyond this. Or say things like, nothing matters, forget it, nothing matters at all. If they start giving things away, this comes under sorting their things out. Like sometimes the doctors come and say for a person who's about to die, who has a limited time, and they ask them to get their things in order. So if this person, without a reason, is getting their things in order, giving away things, things that were important to them, precious to them, and promising them to family and saying, I'm going to write a will or something like that, please make sure that you probe a little further. If they discard previously important belongs, like I said, if they show bipolar tendencies, suddenly cheerful, suddenly depression, if there are attempts to hurt oneself, cutting, banging their head, fists, and you see cut marks and hurt marks every now and then. If children, young people, if you see them in their artwork, in their schoolwork, some scribblings in their journals, something that they've written, if you come across that, that could be a giveaway for you. If they are practicing suicide notes or phrasing things like that, any of this can be a giveaway if they any expressions of bizarre, unsettling. So how can you intervene? Number one, like the doctor said, you're not doing harm by asking. In fact, you might probe if you come across as genuine and concerning. Ask the person directly if he intends to commit suicide, and they might open up a certain percentage of them immediately open up and tell you why and what, and that could lead to a conversation that is empowering and help them. Give them unconditional positive regard. Don't say you're an idiot, this is a stupid idea and all that. Tell them that you're of value, but I want to know why you do not agree with me at this point of time. Verbal contact, like Dr. Tharien mentioned, hey, do you promise not to do anything till we meet next? Sometimes a written contract can also help. Saying, well, you give it to me in writing that you're going to be okay till we meet next Wednesday. It gives them the hope that they can look forward to talking to someone. Please remember the acronym ACT, ask, care, and treat. What are some of the do's and don'ts when it comes to ask? Um, like we said earlier, ask if he or she is thinking of suicide. Listen to what they have to say and acknowledge his or her talk, behavior, and feelings. Don't belittle them. Don't debate about suicide is right or wrong, because that is dwelling too much on the subject. Just step back and listen to what they have to say. Don't discuss whether feelings are good or bad, and don't lecture them on the value of life. They know what the value of life is, but like they just go back to the do's and do that. What do you do when it comes to care? Let them know that you care and understand. Then they can pick up the phone 2 a.m., 3 a.m. in the morning and talk to you. Ask about what exactly is troubling them. Ask specific questions, not just vague things like, yeah, something went wrong in some part of life. Look at them and give undivided attention. Don't keep looking at your phone. Don't keep looking away. Try not to cry if it's a loved one. And ask, how do you plan to do this? What are you thinking about it? Please don't encourage him or her to do it, even jokingly. And like I said before, don't act shocked, because that will get them to distance themselves from you. Beyond this, obtain professional help as soon as possible. Don't leave the person alone. Last week, I was talking to a cared sibling who called me saying the other siblings contemplating suicide. And I said, please attend this seminar and don't leave your sibling alone. Keep a watch out at all points of time. Make sure someone is around. And don't be sworn to secrecy if they say, don't tell anybody out of this. As a counselor, the other counselors who are part of the group will also know that that is one of the reasons to break confidentiality. If there is a threat to life from others or a threat to life by themselves, which is suicide, you can break confidentiality. So don't tell them that, yeah, I promise I won't tell anybody. This is just our secret. That is not right. What else can you say? You're not alone. I'm here for you. Don't say, I understand exactly what you're going through. We do not, but you can say, I might not understand what you're going through, but I care about you and I want to know how I can help you. Ask them what you can do. Ask them about what attempts have they done for seeking help. Have they spoken to someone, offered to find a counselor or a psychologist for them? Please do not say, hey, your life's not that bad. People have it worse. Don't say you have so much to live for. They've gone through all of that. Suicide is selfish, or suicide is the easy way out, or you're a coward, you're running away. It just demoralizes them further, gives them one more reason to go ahead with this. Things could have been worse, is not very encouraging. And finally, don't say you will go to hell if you die by suicide. They just turn around and tell you that my life's hell already. It can't get worse than this. You've lost the argument already. Finally, there is a miracle question that you can ask. Ask them, let's say you go to sleep tonight and somehow there's a miracle that happens in the night and all your problems are solved. Everything that's troubling you is gone. There's no more reason for you to commit suicide. And you don't know this because you're asleep. But when you wake up in the morning, what is the first thing that will tell you that things have changed? What is the first thing you notice about your life which tells you that things are better now and suicide is out of the question? That will give you a good pointer as to what are these top 2 or 3 things that are troubling them, and tells you that this is where they are hoping change would come. And so if those are taken out, you know that the contemplation, the ideation of suicide is taken out. Okay, so that's where we're going to end the